Okay, I think we are ready to start. I want to thank everybody for coming this morning. First and foremost, good morning. Welcome to today's CenterState CEO webinar entitled Pragmatic and Altruistic Leadership During COVID-19. We are so lucky to have Dr. Kimberly Townsend with us this morning. Dr. Townsend is the president and CEO at Loretto. Loretto is a continuing care system in Onondaga and Cayuga counties, which I'm sure we're all familiar with. They offer skilled nursing, housing, managed care, short-term rehabilitation, and medical adult day services. She's also the author of Life Circle Leadership: How Exceptional People Can Make Every Day Extraordinary. And we're going to put the title of that book in the chat because I highly recommend you get a copy for yourself. It's a great read, especially during this time. You can find the book, it's on Amazon, and you can also buy it locally at Barnes & Noble. Dr. Townsend really truly is a role model for anybody who wants to make a positive change in the world. And she, like all of us right now, juggles the demands of family and the pressures of a full-time leadership position, while also finding time to improve herself, her company, and her community through her philosophy of pragmatic altruism. To learn more about Dr. Townsend and her philosophy, please go to www.dr, and that's drkimberlytownsend.com. And just a few ground rules before we get started. I wanted to let you know that this presentation will be recorded and will be available on the CenterState CEO website after the event. The webinar, again, is covering leadership with Dr. Townsend, and we are going to have time for questions at the end of the webinar. But throughout the webinar, if you'd like to enter your questions into the chat box, we will be monitoring the chat, and then we will be able to pose those questions to Dr. Townsend at the end of the presentation. We're very lucky to have Dr. Townsend with us today, and with that, I am going to hand it over.
Great. Thank you so much, Beth, for that kind introduction. And thank you all so much for showing up today to have this conversation around leadership during COVID. And I'm just so grateful to see each and every one of you, kind of seeing with air quotes, but I can't tell you how much I'm looking forward to seeing you all in person again when we can all be in the same room, appropriately social distanced, but together in the same room. And I also want to take a moment to just thank each and every one of you for the kindness that we've seen toward Loretto and toward our frontline caregivers and toward our residents here at Loretto. We have just been overwhelmed by the generosity and kindness of our community towards Loretto in what's a very, very challenging time. And so, you know, I go back as I think about today and the last 12 weeks, which has really been our time frame here for COVID-19, I think of the Chinese proverb, which is, may you live in interesting times. And I would certainly say that we are living in interesting times. I think as we look at COVID, it provides us the opportunity to reframe our thinking personally and for our organizations. And it also gives us the opportunity to bust some paradigms. And I know that's something that we are actively looking at here at Loretto, that we've actively done over the last 12 weeks, that is going to make us a better and stronger and more resilient organization in the future. So when we first discussed this topic, I think it might have actually been pre-COVID. And so I kind of, as I think about this now, I think about, gee, how do we experience pragmatic altruism, that win-win in a global pandemic? And as I was thinking about this topic, I really think it centers for me on 4 lessons that I've learned as a leader during this time. And so I want to share those 4 principles with you today. But as Beth noted, I really want to leave a lot of time at the end to have a dialogue, to have an ongoing discussion with you, because I think there's nothing like a crisis to make us all learners. And so not only am I eager to share the lessons I've learned today, but I'm eager to hear from you in terms of how you're leading and how you're coping, as well as answering any questions you might have really on a broad range of topics, included things like what the heck is going on in nursing homes, right? So I want you to feel free. It's a no judgment zone for questions. No question is too hard or off limits, because I think that this is a great opportunity for us to share and to learn from each other. So today, really the 4 principles that I want to discuss with you are fundamentals, right? These are fundamental issues that every leader grapples with every day. And so those fundamentals are decision making, communication, expectation setting, and people management. But I think we can all agree it looks a little bit different in the midst of a global pandemic. So today, I just want to foster that conversation on things that I've learned. And so as far as decision making goes, I think what I've discovered in this journey is that it is critically important. Next slide, Beth, please. Sorry. Cue up the next slide. It's critically important, and now more than ever as a leader, that we are very clear on the mission of our organization and our purpose as the leader within that organization. So in a volatile and uncertain world, in a feeling like an unsafe and dangerous world, it's critically important that we as leaders identify our North Star. And by North Star, I mean that guiding principle that will guide and direct your actions in the future. And I would tell people that that is part of your value system, and it's critically important to determine what that North Star is, because you are going to have to guide your judgment and your decisions, and you will have to make 1,000 decisions up against that North Star. So for some people, their North Star may be family first. That could be what they're taking out of this. For other people, it might be people over profit. For other people, it may be survival. But for me, my life purpose, that in my North Star that I've discovered in this process, was that it was critically important to me that this organization survive this crisis. So my North Star was that we had to preserve the mission of this 94-year-old organization that exists for the sole purpose of solving big social problems. And so my purpose as a leader today is to ask myself, in this moment, what am I doing to preserve the mission of Loretto? And so that it's here 94 years from now, right? And so I think it's easy to get wrapped up in your organization's mission and your life purpose. But what I would also encourage people is don't lose the joy of discovering those things. Don't lose the joy of that journey of discovery when you're coming to the destination of your life purpose. So we have to balance our joy of discovery of the process against the destination of arriving at our life purpose. So that's the first principle, is being clear about your organization's mission and being clear about your role as the leader within it and your purpose. Next slide, Beth, please. Oh. So the next principle relates to communication. And I think here it's safe to say that KISS, keep it simple, stupid, is really the operating principle as we think of communication today. So I describe this experience of COVID as being similar to Kubler-Ross's stages of grief. Right? And so I think when we first knew that we were all going to be sheltering in place, the first stage was this sense of bravado, like, we can do this. Not only can we do this, but we all want to do this, right? We're excited to do this. So, you know, people learned to play an instrument. Other people like myself took up cooking and they had never been cooking before. Other people were excited to be able to spend that high quality time with their families. And so that was the first stage of COVID. Probably 3 or 4 weeks in, I think we reached the next stage of COVID, which is the stage of denial. Like, wow, this is surreal. Is this really happening to us? Am I really trying to do work from home and homeschool children and manage all of these responsibilities? And furthermore, just denial around how long is this going to go on, right? And so I think there was a period of time where we were all experiencing denial. But now we've reached the third stage of COVID, which I would describe as just sheer exhaustion with the process, right? And so I think one of the more fun things, if there's any fun things that have come from this, have been some of the memes that are online. So my favorite meme that really describes this stage is, y'all married folks holding up okay? I haven't seen a "I'm so blessed" or "he's my everything" in a while, right? And that kind of describes where we're at, right, with this. So people are now, after 12 weeks, they've been homeschooling their children diligently, multiple children. They've been working full-time remotely. And, you know, as I look at it, I would give anything to solve my biggest problem from 4 months ago today. But I can tell you that problem is not coming back anytime in the near future. future. So I think we know in the future we're going to be solving different problems than we had before. And so I think all of us are overwhelmed with information about coronavirus. And I think we're overwhelmed with many of the responsibilities of life. Working full-time, homeschooling children, taking care of family members, concern for vulnerable members in our family. And so I think the most important thing that we can do as leaders today in our communication is to speak simple truths that are easy to grasp. And so recently I was on a conversation with our board about Loretto's post-COVID or post-world strategy after COVID. And I really consolidated it down to 9 words, because I figure 9 words we can all grasp. So in the short term, Loretto's strategy is liquidity. In the medium term, Loretto's strategy is solvency. And in the long term, Loretto's strategy is sustainability. So 9 simple words, easy to grasp and simply stated. And I would encourage all of you to think of the same. Next slide, please, Beth. The next principle is around expectation setting, and that's both your expectations as well as other people's expectations of you. And the lesson that I've learned in terms of managing my own expectations is no matter what people, the government, organizations, other groups may tell you they are going to be able to do for you, we have to discount what they say by 50% for all of the obstacles that we have never encountered before. So a great example of this was around personal protective equipment. So on May 1st, the national healthcare supply chain, medical supply chain, and actually the global supply chain completely shut down. And it shut down because of closures of facilities in Italy that produced critical testing inputs, and it shut down because of an outbreak in China where so many of our medical supplies are sourced. And so as we went out into the market, it was chaos. Every state, every local government, and every healthcare provider was thrust out really into a black market for goods. And so, you know, N95 masks, which were 88 cents a piece in February, were now $6.99 a piece in the black market. And so if I had $1 for every person that told me that they were going to be able to provide PPE to Loretto, I would be a wealthy person today. And it's not that people were malicious, and it's not that people were not well-intentioned, but there were obstacles that came in the way of people fulfilling their best intentions. And so that's how you would manage, that's how I've been managing my own expectations, is by applying that discount factor. But likewise, it's been helpful to me as a leader to manage the expectations of others. So the prime example of that was when COVID started. As a system, we communicated to our staff and to our families and to our residents that it was our aspirational goal and it was our hope that we would never have any cases of coronavirus across Loretto. And for 10 weeks, we had absolutely no cases in our nursing homes. But I always told people that we have had great results through the collective actions of so many well-intentioned people, but in an environment of widespread community transmission and with a virus where you are most contagious 3 to 4 days before you have symptoms, you don't even know you're sick when you're most contagious, that it would be very difficult to have no cases over time. And indeed, on week 10, we did see some cases in our nursing home that we're trying to manage. But so I think it's critically important as leaders that we are both hopeful and aspirational in what we share with people in our communication, but we should identify it as hopeful and aspirational, and we should temper it with the realities and the facts of the situation at hand. Be honest about what you know and be honest about what you don't know. Next slide, please, Beth. And the fourth area that I want to talk about today is just managing people. And I think, I describe some of the behavior that we see as the good, the bad, and the ugly. And I think the one thing we have to understand is that people are in crisis. People are in crisis. And I think whenever people are in crisis, you see both the best of their behaviors, and likewise, you see the worst of their behaviors. We have seen incredible acts of kindness of people in the community toward Loretto and our caregivers and our residents. And likewise, as a society, we've seen some real cases of selfishness and hostility, savagery, and that's people's behavior in crisis. So 33 million Americans right now are unemployed. So, and it's growing every week. Last week it was 3 million. The week before that it was 3 million. More and more people are unemployed. Likewise, by June 1st, they're estimating that we will see 100,000 deaths from COVID-19. And, I think it's safe to say we are in inning 2 of the 9-inning baseball game, right? So we are not out of the woods. Deaths keep climbing. There is community-wide transmission. And if you watch the news, and it doesn't matter which channel, or if you go on social media, or even if you go to the store or go to another public place, I think we're seeing high levels of anger and frustration and impatience and risk-taking. And so I think it's helpful to think about each one of those. So then I always try to think of what is the purpose of anger? So anger is a natural reaction to a sense of uncertainty and a feeling of a lack of control, right? People feel that the world is uncertain and they lack no control over it. And so there's nothing more terrifying to most of us than the unknown. And we are facing an unknown. So anger's purpose is to empower us and to give us a sense of control and a sense of purpose in being right as we face the unknown. But I would always say the compulsive need to be right is a form of violence. And so there's the saying, would you rather be right or would you rather be happy? And so I think as we're seeing people not only in our community, but across the country, having to shut down ice cream stands because people are so angry over some people wearing masks and not other people not wearing masks. People have been killed for not wearing masks in public. And so I think the most important way to counteract this anger is to allow people to express those underlying emotions that are driving that, which is fear, anxiety, a sense of a lack of control, and likewise as a leader, to be open and expressing your own fears, because we all have them. The next thing I think we're seeing quite a bit of is frustration and impatience. So it's safe to say that the economic hardships associated with coronavirus are not falling evenly across the United States, across our citizens. So if you are a small business owner who has not opened your doors in 8 weeks, but all your bills continue to come in, or if you are a person who works in retail, or if you are a person who has been furloughed from your job, then you are in the survival mode. You are currently in the bottom rung of Maslow's hierarchy, which is safety, security, shelter, and food. And so I think we all have to understand that we can't expect people to be generous when they're living in a real life hunger game. So we're seeing a lot of impatience for life getting back to normal. When's my life going to get back to normal? And I think the sad truth is we all know that our lives are not going to get back to normal as we think of it anytime soon, or perhaps ever again. So as a leader, as we're facing this impatience and this frustration, this need to get back to normal, I think we also have to give people hope for the future, that the new normal may be better than the old normal. The third thing that we're seeing a lot of is risk taking, right? People who are like, I'm just getting out there. And there are a lot of people who have to get out there and get back into the workplace because they need it to survive. But frequently, irrational risk taking is resisting reality as it is and kind of imagining a world without consequences. Irrational risk-taking is also incredibly short-sighted and it's selfish. And so I think that there are consequences for all of us if we don't do some simple things. For example, not getting in big crowds of people, right? Which causes transmission, or not observing social distancing amongst us. So there are consequences for those actions. And unfortunately, those consequences fall disproportionately on the most vulnerable members of our society. So in a pre-COVID world, I don't think that there would be anyone who would ever want to expose elderly or children or immune compromised or other vulnerable people to a deadly illness. And so, but in a in a COVID world where we're 12 weeks in, that happens, and we all have to take these risks seriously, and we have to weigh them for ourselves. So back to the fundamentals: decision making, communication, expectation setting, and understanding and managing people. These are all critical skills every day, but they look a little bit different in a global pandemic. And it's our job as leaders to instill a spirit of purpose and optimism in the people who look up to us. And that includes saying, who knows, maybe an uncertain future might be a better one. That's it. So now I would love to take any questions on any topic or have conversations with you on your lessons learned.
Much. Dr. Townsend, thank you so much. That was wonderful. Hearing you say we are in inning 2 of a 9-inning game, I'm feeling a little bit of that frustration you talked about.
I do too.
Yes. And so I think we all can feel that as well. But thank you very much. We do have a question from the group. This is from Jen Phillips, and this was submitted through our chat. It seems as though much of the public-facing workers that have been asked to shoulder the burden to keep going to work are from lower socioeconomic bands. Given that this pandemic is going to be a threat, an issue for a while, how can we keep these employee morale up?
Yeah, so I think as a system and as a leadership team, Loretto really placed its stakes on 2 fundamental principles very early on, because so many, to Jen's point, of our essential workers are those frontline workers who have to show up each day to do their job and to get paid to take care of their family. So the 2 stakes that we made were around, at any cost, getting the personal protective equipment to protect our employees from coronavirus, both when they were here at work as well as when they were out in the community and with their families. And the other one was to restrict visitors from coming into our facilities. And we did that earlier than anyone else did. We did it earlier than was mandated. And we took a lot of heat at the time because it is an enormous sacrifice for families not to see their loved one for 10, 12, 15 weeks, whatever this is going to be. So I think what's most important in protecting those individuals is to make sure that their work site is safe and that we are supporting them. And I think the number one thing that we've done at Loretto to keep our employees' morale up in what's been a very long and lonely vigil is 2 simple words: thank you. I see what you're doing, I value what you're doing, and I thank you for what you're doing. And we've expressed that thank you in many ways. For some of our frontline caregivers who were working double shifts, because some people are afraid and they won't come to work. So for people working double shifts, we packed over 400 week supply of emergency food for them to take home to their families because they couldn't get to the grocery stores. And with young children, sometimes they couldn't get to school to pick up those free lunches. So I think it's important that we say thank you, but I think it's important that we do things that tangibly show that we see them, we value them, and we are thanking them for their sacrifice. But that's a great question.
That is a great question. And I think it's so simple just to say thank you. They're two simple words, but I know very heartfelt for both. So thank you. Thank you. Susie Ippolito has a question for the group and compliments you, Dr. Townsend, saying so many valuable insights. Thank you. You spoke about empowering your business with values that get your brand through challenges. Could you please talk a little bit more about Loretto's core values and how they've helped you as a leader navigate during this time?
So at the core of what we value and what we talk about at Loretto is the notion of the Loretto family. So we are not only a family for the people who we care for, but we are likewise a family with each other. And that has been something that we have been focused on throughout my time here at Loretto. And I think that that has really, that has shown up in such a huge way through this crisis. So as I'm sitting here today, I'm looking out my window at our testing tents. So maybe some of you have heard that the governor placed an executive order that every nursing home and adult care facility employee across New York State has to be tested twice a week for coronavirus. Now, any of you who have had the test know it is a very uncomfortable test. It's a long swab, and it feels like it's up in your brain in order to get the sample to send to the lab. So I'm looking out at the testing tent, and about every 15 seconds, I hear cheers going up out there. So we have a team, an internal team, that is testing employees, and we have people who are standing on the sidelines cheering for people who have just had this test done. So that's the Loretto family. And you can say what your values are, but if it is not evocative and emotional, then it's words and not a real thing. And so as I'm seeing people out there getting tested, and as I'm hearing the cheers go up, it almost brings tears to my eyes, because it makes what we do as the Loretto family real. And that's
Certainly.
what each person should be doing for their brand, right? It's got to be evocative, and it's got to be emotionally tethered to a heart.
That's for sure. And those cheers, I think, are just another way of saying thank you.
Absolutely, because you know what? We have a lot of employees that are afraid of going to the doctor. Nobody is willingly signing up typically for the coronavirus test. I mean, it's uncomfortable, but they're doing it because they want to be here, right? Mm-hmm. They want to be safe for themselves and for their families, but they want to be safe for the people we're caring for. And I'm just so grateful to lead an organization of people who are that mission minded.
Certainly. And thank God for your employees.
Yes. Amen.
Yes. And another question from our group. Do you have any guidance on impatience? The context I'm referring to is essential folks that are physically at work, communicating with other employees who are working from home. Sometimes those at home are impatient because they're not getting answers to questions immediately, as they would when we could walk down the hall, and vice versa for those in the office needing info from those folks and having to wait for responses. Also, sometimes it's due to technical issues or because someone is afraid to return yet in person, and everyone has a different situation. Any words of wisdom on impatience would be greatly appreciated. And this is from Joanne.
Yeah, and I think that that's where the leader's role is so important in terms of calling out the challenges that we're facing, right? To be open and transparent about the challenges that we're facing. While we have some workers who may be remote, may have some people in the office, we may have some people who have decided to sit on the sidelines because they're afraid, and then we have some people that we have to have sit on the sidelines because they're immune compromised or have other challenges. And that's why it's really important to have that ongoing communication with your workforce. So here at Loretto, the senior leadership team meets every morning virtually, and we discuss issues. And likewise, those leaders then go to their employees and discuss the challenges that we're experiencing. Once a week, we do an all-manager town hall and probably 400 or 500 people on the phone. And we talk about how things are going, challenges that people are experiencing, what we're doing to try to mitigate those challenges. But I think the worst thing you can do as a leader when people are experiencing inconveniences, technology's not working, people aren't calling me back, the worst thing you can do is ignore it and pretend it's not happening. The most important thing you can do is face it and to encourage everyone to extend each other a little bit of grace in what's a very challenging time. I always tell people, assume the best, right? We have to assume the best intentions of each other, because it's my philosophy that 99.9% of people show up to work every day, whether that work is in their living room or in the office or wherever, up on the floor. 99.9% of the people really want to do their very best. And so we have to be gracious towards each other in this difficult time.
Excellent advice, especially I'll use CenterState CEO as an example. As we are preparing to get back into the office, we won't be at 100% capacity. So there will be some people in the office and some people at home, and that'll change on a daily basis. So I think you hit the nail on the head when you said you just have to give them some grace and know that we're all juggling a lot of balls right now. That's for sure. That's for sure. Another question from Chris Bolt. Another compliment. Always great to hear Dr. Townsend speak about leadership. Any ideas as a leader about balancing compassion and understanding of people's fears and home circumstances with focusing on job duties and responsibilities?
Yeah, this is incredibly challenging because so much of expectation management is managing the expectations of people within your own family regarding, what the demands of your job are versus what are your demands of managing a household that's really been turned upside down. And so I think, as I look at that expectation management within our own families, I think that open and honest conversation regarding what you see as the demands of your work, what you are feeling as it relates to those demands, and then what you are seeing as the demands of your family and your feelings associated with that. That's all critically important things to discuss. And so I think, as you look at people who are working full-time jobs, and a full-time job in the US is not 40 hours a week. For a lot of us, it's 50 plus hours a week, doing that from your home, while in some cases you're doing young child management, right? You're not bringing your kids to a babysitter or a daycare, or doing homeschooling of multiple children, sometimes using one or two computers. You got 3 kids, you got 1 computer or 1 iPad. It's chaos. Everything is turned upside down. And so I think it's important to be clear on what you see is as your obligations, your responsibilities, both as a partner, a parent, as well as an employee, and putting all of those in balance, however, is going to be, practically speaking, very challenging when you're having to do all that from home. And so I would say the most important thing is to be, we talked about being gracious with others. You have to be kind to yourself, right? Don't give up some level of self-care, even if that's taking a 10-minute walk by yourself in your backyard to take a break from things. And be kind to yourself in your intentions. We're all trying to do our best, and we probably all feel a bit of guilt. We may feel a little bit of inadequacy to the task, because let's face it, it's a Herculean task, managing a new life as it is in very challenging circumstances.
Definitely a Herculean task. I couldn't agree with you more. And also something none of us have ever experienced before. There's no textbook for this. There was not a class in college about this. So we are all navigating this as brand new captains, so to speak.
Well, and it was so sudden, right? It's not like if somebody told you today that 6 months from now, you are going to be working fully remotely, managing your personal life, whatever that is, all within a very small scope, a very, very small world. I think we could have all psychologically prepared ourselves for it and maybe practically prepared. We've been thrust into this. There was no psychological preparation for this, and there was no practical preparation for this. And I think every person is reacting differently. For every child who is stressing out because they want to be on every Zoom meeting and Zoom class that they have, there's the kid that you can't find, right? There's the kid that's hiding out and hasn't joined a Zoom class in 3 weeks while you're holding down the fort and keeping your job. Gotta realize unprecedented times. And I know that phrase is overused, but it's true.
Yes, no, I couldn't agree more. This is a great question we have in the chat that I want to pose to you. How do I find other organizations that might have mutual benefits from a partnership with my company right now?
Well, I think a great place to look as a starter is to those organizations who have provided support to you through this crisis, whether that was the donation of face shields or the donation of meals for workers, or in our case, we received a wonderful donation of formula from the food bank for our employees. So I think you can go to those organizations first, but I would tell you not to overlook the organizations and the leaders who have been encouraging, who have just sent an encouraging word. I know when this, within a few weeks of really being immersed in our new COVID reality, I reached out to a list of leaders in the community that I don't talk to on a daily basis, just to say, how are you doing? How could I be helpful? And thank you for what you're doing, and hang in there. And I had so many people who have done the same for me. And those are great people to look to for the future. And then I would say we cannot neglect a couple of hard facts that we all know, which is domestic violence is up 30% as people are having to shelter in place. alcohol sales, like this was supposed to be the big alcohol-free year, right? A lot of people were talking about, oh, I'm going to try an alcohol-free month or whatever. Well, alcohol sales are up 25% pre-COVID. And there's a lot of people that are struggling. And so I think too, it's always important to look at those resources in our community that can best support our employees, whether that's Vera House or Liberty Resources or ACR or even your own employee assistance programs. But it's so important to look around and to support people who may be struggling and to throw out that lifeline. And that's what we can do, not only to find partners, but also to be a good partner to others.
Excellent. I think we have time for one more quick question because I do want to be respectful of everybody's time. And I think this is a good one. How often should I be communicating with my employees during this time and my customers?
Constantly. So I would say this is no time to let the urgent crowd out the important. So the urgent issues are just the firestorms that happen on a minute-by-minute basis when you're managing an organization in a crisis, right? And so those urgent things are just, they're never going to go away. But you have to remember what's important, and what's really important are your employees, who are your front line to your customers. And I don't care what business you're in, whether you're a manufacturer and it's your frontline employees who are making a great product, or whether it's a healthcare provider whose frontline employees are giving care and love to individuals in a hard time. So I think you have to remember what's important in your customers. You have to make sure that you're sharing with them in an open and honest and transparent way the things that are going well and the things that you're working on. And I think that employees appreciate honesty and transparency, and I believe customers appreciate honesty and transparency. And so communicate constantly and do it in a spirit of honesty and transparency. It sounds simple, but it can be hard to do because it can lead to difficult conversations. And, you know, as people, we all resist those, right? Nobody loves to walk into a room where you know it's going to be a difficult conversation, but that's why we're leaders.
And also making the time to communicate to these audiences because we're all so busy right now. So,
absolutely. Yeah. Well, and it's really honoring, it's honoring the value that they bring to your organization and to you personally as a leader.
Absolutely. I think that's a great note to end on. And I want to thank you, Dr. Townsend, so much for being with us this morning. I think some of the information that you shared, I know so many of our attendees will take back and implement in their own workplaces. I know that you've given me a lot of things to think about, so I appreciate that very much. Again, I want to encourage folks, Dr. Townsend does have a book, which I have had the honor of reading, and it's wonderful. Life Circle Leadership, How Exceptional People Make Every Day Extraordinary. You can find it on Amazon and also at your local Barnes & Noble. And also, if you don't follow Dr. Townsend on LinkedIn, I would highly recommend you do so. I love your when you update your blogs, and I'm able to click directly to those from your LinkedIn profile. So those are also great reads. Thank you very much. And I also want to share with the group, CenterState CEO, we talked to Dr. Townsend about resources as a company, reaching out to other companies that can be a resource to you. And CenterState CEO really is one of those resources. Please visit our website. Right on the homepage, we have a link to our COVID-19 resources. Also, our reopening toolkit. As companies are looking to make plans to get back into the workplace. This is a toolkit that helps them develop a plan to do so, and also links you to members of the business community that can help you in those efforts. Also, like this morning, we have a number of different events planned. They are both professional development, networking, etc. Those can be found on the events calendar of our website. And also, we encourage you to engage with us on our social media platforms, Facebook, Instagram, Twitter, and LinkedIn. With that, I want to again say thank you.
And thank you, Beth, for moderating today. And thank you to each one of you who have come today. Stay safe so we can get together in person soon.
Exactly. And we end all of our CenterState CEO meetings with, please go wash your hands. So thank you, everybody. I appreciate you being here today. Have a great day.
Thank you.
Thank you.